Thank you everybody for joining us. I think we will wait a few minutes to more people to join us, and then we will start.
Hi, Rotem. Good to see you.
Hey, Isabel. Good to see you. Thank you for joining us. Hi, Wyatt. Hey, Leslie.
Hi, just leaving your former employment.
I see you leaving the JCA right now.
That's correct. I am. I could squeeze it in between teaching and this.
Perfect. Thank you so much.
And Rotem, hopefully we're going to talk about this today, but I have my fingers crossed. I'm going to try and reschedule to come see you around Purim.
Both of my fingers crossed. So
yeah, and if
I'm waiting.
If that doesn't work, then it'll be Independence Day. So.
Oh wow! I wish it will work out. Hey, Gail.
Well,
hi, everybody. Thank you for joining us. A couple of more minutes, and then we will start. This is a nice crowd. Thank you, everybody, for joining us this Sunday afternoon. This is evening in Be'er Sheva. Maybe night.
Also in Jerusalem.
Also in Jerusalem.
Well, then I think we can start. It's 2:02 here. We also, by the way, live on Facebook. If you don't like it, please let me know via chat, and we'll figure out what to do. You can also not put the video on so then nobody can see your face, but basically we're going to pin the speaker so everybody will see the speaker. So Rotem, the stage is all yours.
Thank you, Anna. This is the first time that someone introduced me and said Rotem correctly, so I appreciate your R. That's your Israeli roots. Hi, everybody. Thank you so much for joining us. This is our first Israel program with the Jewish Federation of Colombia in South Carolina. So I know all of you across the Southeast and some are in Israel. Thank you very much for dedicating your time for us this afternoon or night, whatever it finds you. We have a special guest today with us, talking about one of the most important things in the world right now in the last 2 years. I'm sure you heard about this, the coronavirus. And so Professor Rosen is with us. But because it's our first program, I will introduce myself in a minute, and I put this. Okay, so this is my contact if you want to be in touch with me, if you have any question. My job here is to be a virtual shaliach to help the Jewish Federation of Colombia bring Israel program to you in many different topics, in many different aspects. So I'm here for you. You can reach out to me via any platform you want. And I'm 28. I live in Be'er Sheva, which is in the south of Israel. I am in school for my bachelor degree in political science, the studies of the state of Israel in European studies. It sounds very big, but it's not that much. This is my second year in school, and I used to be a shaliach in Jacksonville, Florida for 2 years. Last year, I did this program, this virtual program with some communities in the Southeast. And this year, I'm fortunate enough to do this with Colombia. So here's my contact. I'm gonna pass it to Professor Rosen. Thank you so much again for joining us. I know your time is very important. I know you're very busy helping us getting out of this big crisis called COVID-19, but we have this time to listen to everything you have to say for us. If you guys have any question during this lecture, you can always tap it at the chat, and I'm sure Professor Rosen will give some times at the end for some questions. So thank you again, and Up to you.
Okay, Rotem, thank you so much. And Anna, also thank you. And thank you to everybody for joining us. I'm going to be speaking about one aspect of how Israel has responded to COVID-19, and that is that we're very good at acting quickly, responding to different challenges quickly. That's not to say that in general we've been great at handling COVID. In Israel, as in the US, as in Europe, as everywhere, it's been a terrible 2 years, and too many deaths, and too much illness, and too much economic damage, and we've made our share of mistakes too. I mean, every country is grappling with an unknown. We've all had some successes and some failings. I'm not going to give an overview of all of Israel's successes and failings. I'm just going to give you a slice of one thing that we did pretty well. But before I do that, I would appreciate if one of the people, one of our lay people from Colombia, could just share with me a little bit about what's the situation on the ground now with COVID-19 in Colombia. So just to have a sense of, as I'm speaking to you, what you're going through now. Could any of you share with me the situation there right now? Anna, you want to help us out here? Is everybody muted on deliberate?
You can just jump in if somebody wants to share a little bit what's going on in Colombia. I'm sure some of you know more than I do, but if not, I will share from what I know.
I can say some things after you share. I just didn't unmute myself because I'm driving, but now I'm at a red light.
Okay, so you go ahead and I will add.
You sure? Okay.
Yes.
Well, Colombia is kind of different than any place else in the United States in terms of the Northeast or the coasts, put it that way, or Canada. It's pretty south and pretty runs by political party in terms of whether you're masking or not masking. The county that the synagogues and the JCC are in have been pretty strong enforcers of masking and all of that in schools, also promoting vaccination and booster and so on. But still at this point, I think as of this week, we are still at 51.2% only in South Carolina, fully vaccinated. 60% have gotten one shot, and pretty low numbers for kids, though higher numbers for the 12 to 18 crowd. The 12-year-old crowd, the middle school, high school crowd. And we are at 30+% positivity rate.
How are things going in terms of Omicron now?
And Omicron, so just last week, Delta was the higher variant, and now Omicron is. And most of the people who are getting sick and being hospitalized are unvaccinated, though in the Jewish community, I can tell you, just from kids and parents and adults getting in touch with me, that there have been a number of breakthrough cases, though not serious, more flu-like symptoms, mild flu symptoms. And Tree of Life, one congregation has put services on hold for a while, and we are going, in our congregation, we're going to KN95 masks for everybody, or else you can't come in.
Okay, that's a good start. Anybody else want to add anything about what you're going through now? Anna, you want to help us out here?
I think Risa submitted it pretty well. Prior coming to Colombia, I spent the majority of COVID up north in Boston. And definitely there is huge difference how both of the states dealt COVID and still dealing with COVID. So I've been yelled walking around the streets in Boston without a mask. And here you can go to any store without a mask and nobody will tell you if it's wrong or right. So sometimes it feels like it's more liberated here and you can do whatever you want. But on the other hand, you interacting with people that you know for sure that they're not vaccinated, and they start preaching you why vaccination is wrong. And I just came back from Miami, and I had dinner with people that literally sort of kind of pushed back very aggressively about me being vaccinated and preaching pro-vaccination. So this is how it is in the South, and I think Israel is a very nice example how quickly we can respond. So again, Bruce, thank you so much for being with us today.
Okay, all right, so I'm going to start my presentation, and I'll stop every so often to see if there are any comments or questions. So wish me luck with my share screen, please. Can you see it?
Yes, perfect.
Okay, so my topic today is Israel as a rapid responder during the COVID-19 pandemic. And why is it not moving? Oh, okay. So some of the areas in which Israel's been a rapid responder have related to the vaccinations. I'll go through each of these points. In the initial rollout about a year ago, various studies about the impact of the vaccines, and also one of the first to do the boosters. But our tendency to respond rapidly has not just been around the vaccines, it's also been on a whole set of other areas, which you see in the other column of my screen. I'll talk about all those. I'll talk about those relatively briefly. My own area of research is mostly around the vaccines, so I'll talk about that a little bit more. So the initial rollout, December 2020, just over a year ago, just a few days after the US FDA approved the Pfizer vaccine, Israel also approved it. We basically piggybacked on the FDA analysis. And by the end of December, 10 days later, we had 16% of our population had a first vaccine. And we were way ahead of everybody else. That was true also at the end of January and the end of February. By the summer, we were no longer such a leader. UK was ahead of us, Netherlands, United Arab Emirates, our new buddies in the Abraham Accords. It sort of shows Israel's really good at doing sprints. We're less good at marathons, but we like to get out there quickly. When my colleagues and I, by the way, Ruth Weitzberg is a colleague of mine at Brookdale, but was a doctoral student of Don Greenberg, who was also on the phone on the call with us. So we saw this happening already a few days into the vaccination campaign. We said we got to write this up. So within a week, we wrote an article. And within a month, we had it published, and it's been one of the most cited and downloaded articles in the social sciences about the pandemic. And we analyzed what it was about Israel that let it get so many people vaccinated so quickly. And we grouped it into three categories. The first is characteristics of Israel that have been around for a long time that are not part of healthcare. So I'll give a couple of examples of that. We don't have a federal state system like you have in the US. We only have a national government. So it's very clear who is responsible. In the US, you lost a little bit of time because there was a lot of pushback who is supposed to be leading this, the national government or the state government, and a lot of confusion there. Another key issue is that we're small. So we were able to, sometimes being big has advantages because then you have market power, but sometimes being small means you can be more agile. So we're able to quickly buy up a lot of, it's one of the reasons we're able to quickly buy up a lot of vaccines because we weren't going to take up a big chunk of the market. So those are some things about Israel that are extrinsic to healthcare. There are also some benefits that were specific to the health system. One is that we have a long tradition of emergency preparedness, and all the players know how to work together: government, hospitals, health insurers, doctor associations. So they practice that mostly around security challenges, but it also comes in handy when you have a natural disaster or a medical disaster. So people, not that there wasn't some confusion, there was, and there's still a lot of miscommunication, but compared to what we hear from other countries that aren't used to working together, we had that advantage. Another big advantage we have is that everybody is insured in one of 4 large competing nonprofit health plans. And those health plans are quite well run national organizations with really good information systems. So they know right away who's been vaccinated, who should be vaccinated, and isn't vaccinated, all those, and also good ways to communicate with their members through through the iPhones, etc. And then there were some things that Israel did right with regard to the vaccination effort itself. One is we bought up a lot of vaccines real early. The leadership realized that our only way to get through this epidemic was to vaccinate widely. So they cut a deal with Pfizer, both paying above market prices and also convincing Pfizer that Israel would be an important laboratory for them or test case for them, because we would be able to relatively quickly have good information about how the vaccines are working. So that's one thing we did well. And another thing that we did well was that we had very simple and clear criteria for who was going to get vaccinated in the first round. Some of the other countries have such complicated formulas that unless you have a doctorate in health policy, you don't know if you're supposed to be vaccinated or not. But by us, if you're over 60 or you're a healthcare worker, basically. It was very straightforward. So those are some of the reasons that we were able to get our rollout done real quickly. But we didn't just vaccinate, we also were a world leader in seeing how these vaccinations are impacting health, safety, and efficacy. You know, these have been tested in very serious clinical trials, but oftentimes what works in clinical trials doesn't work as well in the real world. And you start hitting bumps and snags. So again, well, I'll just show you some of the articles. This is an article by some friends of Dan and mine, a group from the Colite Research Institute, and they're together with some colleagues of theirs from Harvard. This was the first of a peer-reviewed major study of the impact of the vaccines outside of a clinical trial. And it has been cited over 500 times of New England Journal of Medicine articles related to vaccines. It is the second most, published in 2021, is the second most cited article, and it has played a real important impact, not just in policy development in Israel, but also being used by other countries in making their decisions. So here, another article by the same group looking at the safety, which takes a little bit longer to look at, also in New England. By the way, as I'm sure those of you in the health field know, New England Journal of Medicine is perhaps the most prestigious medical journal. And in general, about 2 to 3% of the articles are by Israeli, have at least one author from Israel. Of the 25 most cited articles about the vaccines, 5 of those 25 were by Israeli authors. So we have really playing an important role in the scientific telling of assessment and telling of the story. So the first series test of the boosters, assessments of how it's affecting certain heart condition. Israelis try to publish not just in the New England Journal, there are other important journals. So in Nature, the important study of at the macro level of the impact of the vaccinations, and in Lancet and other places. So what is it about Israel that enabled it to be such a leader in terms of these rigorous impact studies? So first of all, because we were fast in the rollout. If you haven't done it, you can't study it. So by being first in the actual doing of it, we were in a position to relatively quickly assess the impact. But of course, that's not enough. We also had to have good data, and we have these good electronic health records. You have to have good researchers, and it certainly helps if they're connected internationally. So those are the things that we brought to it. We're also a leader in terms of the boosters. Here, we didn't even wait for the FDA approval. About a month before the formal FDA approval, Israel started administering boosters. And Israel's also been relatively fast about now doing, I got my 4th vaccine a few days ago. So Israel's quick off the blocks on a lot of things having to do with vaccinations. Before I go any further, I'm going to stop sharing and see if there are any comments or questions about this first half of the presentation.
Say the percentage.
Can you tell us a little bit about the people that are resisting vaccinations?
Who's asking? Who's this? Who's am I getting this from? I can't see.
Actually, I am Heidi Lovett, but I'm not on the screen.
Oh, you're Heidi's iPhone. Hi, Heidi's iPhone.
Yeah, my husband's
Yes.
on the iPad. But
Yes, that happens.
Heidi's
Yes.
hiding.
I'm hiding for some obvious reasons, but is there any
Okay.
resistance in getting the vaccination from the religious or other situations?
Parts of the population.
Okay, so yeah, so I think as in all over the world, you have a whole range of different people who are not vaccinated. Some are not vaccinated because they're dead set against it. And I think it's a terrible, terrible thing, and that's a small group. But there's a much larger group that says, I'm not so sure, I'm not convinced, I have my concerns, and you have those in all groups of the population. There were two groups in Israel that initially were much less vaccinated. That was our ultra-Orthodox population and the Arab population. And then Israel undertook a very special effort to reach out to those two groups, working with community leaders, developing culturally appropriate vaccination outreach, and the gaps significantly closed. They didn't totally close, but they closed significantly. Dan, do you want to add anything to that? No. Okay. Does that answer your question, Heidi's iPhone?
Yeah, that does. I mean, obviously, the United States seems to have more of a political preference than I think Israel would have. But I was just wondering, if it's mandated that you have to get it,
No, there's no requirement.
Okay.
And it's definitely not on political lines. It's not a red state, blue state kind of thing here.
Right.
But I will tell you one interesting thing about, even though it's not mandated, I have a 30-year-old daughter who's single, and she lives in a neighborhood with lots of singles, and they often have each other over for Shabbat meals. And it became clear that if you weren't vaccinated, you weren't getting invited to the meals.
Yeah.
No one was yelling at you or denouncing you in the street, but if you wanted to be part of the community, you really had to be vaccinated. And that was not from government. That was just, friends.
And that helps.
Anybody else?
Inclusion is very important.
Yeah. Yep.
Peer pressure. All right. Thank
Okay.
you. That answers my question.
Okay. Anybody else? Either the people that we see live, or the people whose photos we see, or people whose names we see.
Wyatt want to say something.
Yeah, thank you, Rotem. Yeah, so I guess the question, you were mentioning that it's not mandated, but you do have the green pass system, and I don't know if you'll be getting into that, but I mean, that's some of the political things that we have in the US, or this issue of, well, what do you mean I can't go in a restaurant just because I'm not vaccinated? Well, I mean, I think Israel's had that for quite a while now in terms of being able to go indoors in places.
Right. I think that's a great question, Wyatt. Thank you. So, Israel was indeed one of the first countries to have some sort of green pass program. Initially, and what is a green pass? It says in order to be able to go to certain events or certain settings, you need to have proof of that you've been vaccinated, or some other, or had a recent test that shows that you're a negative, so you're not infectious. So Israel did this relatively quickly. It started just with cultural events. Sporting events, things that are wonderful to have, are an important part of our lives, but are not like getting to your job or even getting to a restaurant. So I started out very light on things that were not perceived by people as so politically sensitive. And we also did it at a point where we had most of the population vaccinated. You can't really roll that out when a lot of people are either dead set against the vaccinations or only a small percentage is vaccinated. So we rolled it out, and it was reasonably well received. And then it got expanded to other settings. And depending on where we are in our cycle of new waves and new variants, they keep changing the rules. And that's driving everybody nutty and crazy. You think you know the rules, and then they change on you because there's new variants. So I think like that, on that issue, we must have in common with the whole world. I don't know if that helps your question, Wyatt, but maybe at least partly addresses your question. Anybody else want to ask a question?
Oh, hi, I'm David. I'm on Heidi's iPad.
I hope you're her husband. You're her husband,
Yeah,
right? Okay, good. I wouldn't want some other guy on her.
Have you had any other issues with treatment in hospitals and things like that with patients that were not vaccinated?
He's going to get into a lot of that later.
Are you going to get into that later?
But it's okay. If you raise it now, I'll talk about it. Yeah, I mean, the first few months, like I think around the world, was a madhouse. tons of people. This is, of course, way before the vaccines. And, hospitals were getting overwhelmed and medical staff were exhausted, and often, they're exhausted. Some of them are getting sick. There's fewer health professionals in the hospitals, so they're even more overworked and getting sick more. It was terrible. Friends of ours in the hospitals, whether they were frontline or hospital directors, talk about a really, really terrible, terrible period. And then eventually it got better as the system got more organized, as we were able to pull in more assistance from, let's say, from the Israel Defense Forces, to pull in some staff from there. During Delta, it wasn't so bad during the Delta wave because we had vaccines were in place. Of course, there were some breakthrough infections. There were people who were not vaccinated, but the numbers were under control. And the big question now around Omicron is how bad it's going to be. We know the infection rates, of course, are through the roof.
Right.
But they're telling us that in general it's milder. But how will those two factors play out? More infections, but more mild overall. Initially, it seemed that the number of serious cases wasn't going up, but it's already now double what it was a month ago. So people are getting nervous again. Will the hospital system be overwhelmed? We don't know yet.
I was
serious issue.
Yeah, I was really more wondering about the how staff were treating, having all these people coming in needing treatment, yet they weren't vaccinated. I mean, I
think the medical staff around the world are really been heroes. They're doing the right thing, and you treat everybody based on the need, irrespective of whether they got vaccinated or not, whether they are from your same political party, whether they're Arab or Jewish, whether they're Palestinian Authority from Israel. I think health almost always can transcend these political issues and even issues of conflict. I think they're just there for us. They're amazing.
Well, I mean, I understand that people are amazing and things like that, but what the issues I'm talking about is, say, financial. Israel's got
different health
it's a different health system. The government pays for it, and yet, so when you have a hospital full of people that aren't vaccinated, when you give somebody a vaccination, the vaccination is relatively inexpensive. So you have the opportunity to say, to stop a problem here by just getting people vaccinated. And then the people that aren't vaccinated are winding up still going to the hospitals, still seriously ill. How does that affect the health system? I mean, the cost of the health system has to be, you're still increasing the cost for these people not being, they're not thinking about their community. I look at it like this: someone who doesn't get vaccinated, whether you're religious or not, it's a community response. I think that you're doing it for your community by getting vaccinated, whether you want to or not, because the only way that the disease is going to abate is to get enough people vaccinated to have herd immunity. I mean, Israel's
I hear your point. Let me respond.
Okay.
Yes, obviously vaccinations make a huge difference, and it's the good thing and the right thing to do. On the other hand, we're seeing with Omicron that even many people who are vaccinated are getting hospitalized anyway. So it's not that's what seemed very straightforward and simple a month ago is now getting a little bit more blurred. Second, it's put huge strains on the hospitals, not just in terms of manpower, but also financially. And the government has had to come through with some more money for the hospitals. And they've given more money, and this, of course, fights about whether they've given enough. In Israel, we're in a relatively good situation because our economy has been hit less by COVID. Why is that? Partly because we got the vaccinations out early, but mostly because our economy is very high-tech dependent. And high-tech has been less affected because, you can work from home.
Right.
Israel had a bumper year this past year in terms of IPOs for new high-tech startup companies. So even though there's been this huge need for government expenses, the money's been flowing into the treasury in a way that's been made possible for Israel to handle it. Okay?
Mm-hmm.
Again, it's much less of a partisan issue in Israel. The vaccinated people are frustrated with unvaccinated people, but with less anger and less of an edge than I think you have in the US right now. Okay, I'm going to go on to the second half of the presentation, if that's okay. Can you see it? Yeah.
Yes.
Okay. So here are some other areas in which Israel has been, how do I do this? Is been ahead of the curve. So we were among the first countries to close our borders. Already in January 2 years ago, we closed, we do a lot of commercial stuff with China, and we closed the borders to people from China initially, and then eventually that got expanded to closing the borders much more broadly. Now, why was Israel able to close its borders early? I guess for two reasons. One is we only have one real port of entry, and that's one major port of entry, and that's our Ben Gurion Airport. So when you only have one major entry place, it's easier to control it. The second is, again, our experience because of our geopolitical situation. We have a lot of experience with closing borders and knowing how to close borders. Expansion of hospital capacities. So already in the first wave, Israel very quickly set up new units, whether in the basements or the parking lots. They pulled in new staff from retired health professionals from the Israel Defense Forces and elsewhere. And they put in new beds, again, related to our general need to be prepared for national emergencies, typically of a security nature. So we know how to make those things happen. And also because we have a national health insurance system, we know how to get the parts to work together. It's not to say we have a national health system. Our health system is not all run by the government. We have a lot of nonprofits, but they know the pieces know how to work together. This was written up in health policy. Another thing we did relatively early is you want to track where the disease is spreading. So to some extent, you could do that by people who are going for testing and seeing how many people are testing positive. But not everybody goes for tests, and sometimes it takes time. So Israel made use of a technique that we had learned from WHO 10 years earlier when we had a silent polio outbreak. So you test the water in the wastewater system, and you can see which neighborhoods have high concentrations of virus. And you can see that before it's showing up through the testing system of individuals. Sorry about that. We're a leader in terms of digital surveillance for contact tracing. Initially, we tried to do it by the traditional methods of epidemiology. You talk to the person who's infected and you find out where they were and you check who else was in that area. But the numbers were so overwhelming that the system couldn't handle that. So there was because of our security situation and as an anti-terrorism measure, we as a country or our security services know how to use iPhones to track who was where. So for a few days, the country deliberated on whether this was the appropriate thing to do because this is something that's usually just used for security purposes. Is it going to be too much of an invasion of privacy? Now, the people who were for doing it said, yeah, but this is a public health emergency. And the other people against it said, yeah, but it's a slippery slope. You start here, are we going to become a police state, or is it going to be sooner or later that everything's going to be emergency? The government's always going to know where we are. So the country deliberated that for about a week and then decided we'll do it, but only on a time-limited basis. It has to be legislation. It's not just a government decision. So it was done for a while, and then they stopped it. And they developed other systems for doing tracking. This was written up. There's a lot of interest in it because Israel, again, was one of the first countries to do this. And then the green passes I mentioned earlier. I'm not going to mention it again. So what you see is that in a whole bunch of areas, time after time, Israel is doing things first. Not always doing it better, making lots of other mistakes. But one thing you can say about Israel is that it does things quickly. And what is it about Israel that leads to this being the first out of the gate time after time? So I'll mention things that many of which I mentioned in the course of the presentation. We're prepared for emergencies. We're also a very goal-oriented society, for good and for bad. Helps us get to our goals, but sometimes we bump into some other things on the side because we're so focused on the goals. The process isn't always as it should be. We have this culture in the high-tech area and elsewhere of being innovative and responding rapidly. We always look to see what's happening in other countries, and we ask experts from abroad, but we don't let them dictate to us. Just that the fact that the WHO is saying one thing, we want to hear about that because there's a lot of expertise, but in the end, our situation is different, and we're going to make our own decisions. So it's a good combination, we think. Our scientific community is strong. We're very digitalized. And because we got a quick start with the vaccines, it helped us get a quick start with other stuff as well. So thanks, and I'll be happy to take any comments or questions. I don't want to do a new share. Stop share. Okay, that's my presentation. I'm happy to take comments or questions. And if there are no comments and questions, did that ring true with the Israel that you guys know? Are any of you people who tried to come to Israel over the last few months and couldn't because Israel closed its borders?
Yes, me.
Yeah, I know some.
Gail, how are you feeling about that?
Horrible, horrible. I still
Yeah.
haven't gotten over it. I actually went to Rome and had a ticket from Rome to Israel on the 29th of November. And on the 28th of November, Israel shut the door.
Wow.
I still have not gotten over it, and I am not planning to come again until I know for sure that this won't happen, because it was sort of devastating. I would have never gone to Rome. I would have never gone to Rome if it hadn't been that it was going to be an easy trip to Israel from there.
Do you have family in Israel?
I have some cousins, but I have some really dear friends that they have a son there, and they rent an apartment, and I was going to stay with them in their apartment. And they were going on the 29th too.
So I have a brother in New Jersey who's 73 years old. He and his wife were hoping to come to Israel. They have a son and daughter-in-law, but mostly, of course, they want to see their 5 grandchildren. They had tickets, and then Israel slammed the gates, and they are very, very disappointed, very frustrated. I'm glad that now things are opening up.
Well, my granddaughter is coming there for the Alexander Muss High School in Israel program in a couple of weeks.
That's great.
It looks like she'll make it.
That's great. Anybody else have a personal experience they want to share?
Yeah, sorry, this is Wyatt. I was supposed to leave and go on December 3rd or 4th. And so I missed it by about 3 days. I was going to go, I've rescheduled my Israel trip 5 times so far in the last year and a half. And I was going to come for my 50th birthday. And as I was saying at the beginning of the call, I'm telling Rotem now that I'm hoping for Purim. I know that the gates are open, but I'm going to wait and see what happens with numbers on the virus here and in Israel before I book anything.
Good. I hope we'll see you here in Purim, and if not Purim,
but I was also supposed.
Yeah,
I was also supposed to go to Germany in November, and I passed on. I canceled that trip on my own to protect the Israel trip because I didn't want to risk it. So
it is a crazy period. It's a crazy period. I personally do not think that Israel did the right thing to close the doors, particularly for Jewish people who have family in Israel. People are panicky, people are scared, but then you got to the point where, with so many people in Israel already have the illness, and people catching it from one another, it just made no sense to keep the skies closed anymore. I guess the decision that the government made probably came from a good place. I happen to disagree with that.
I have a sad story to share about not going to Israel. I haven't seen my family for 2 years due to COVID, because I was.
You don't have Zoom? They don't have Zoom?
They do have Zoom, so I've seen them, but not physically.
Oh.
So I haven't seen them because they're in Ukraine right now, and Ukraine have their own deal and balagan with COVID. So we were supposed to meet after 2 years in Israel, and it was a few days before my flight that they shut the borders, and my parents' flight was canceled. So we decided to postpone to better time. So it was very sad moment. So that's why I went to Miami. That's the little Israel in the United States.
I have a question.
Yeah.
To go to Israel, do you have to show proof of vaccination or just proof of a clean COVID test?
I don't know. I think you have to be vaccinated. I'm not sure.
Okay.
Yeah.
I
Dan
know
wrote
to come back to
down.
the United States, all you have to do is have a negative COVID test within 3 days. I don't believe you have to show a COVID test. I mean, a vaccination. So I'm just
So
wondering how Israel is.
Yeah, so as far as I know, and again, they changing their rules all the time. You need to be vaccinated or to be recovered from COVID and to have like a paper that show that you recovered, because then you have antibodies.
Right. But you don't
And
have to have a vaccination, is what you're saying.
it's either or.
Right.
But if you don't have one of them, you cannot enter the country.
Right. But if
And-
you have a negative,
As far as I know.
I married off my youngest daughter 2 months ago, and we have very close family. My wife's brother and his family, we're very close to them from Boston, and we were trying to get them to get approved to get in. They were fully vaccinated. The bureaucracy was terrible, and we did manage to get them in the last minute, but it was just very challenging. Dan, Rotem, you guys want to add anything from your experience?
I think that Rotem just came back from Vienna. So how was it, Rotem?
I have to say that this time it was the easiest. I traveled few times during COVID-19. I'm young and energetic, and I'm not letting anything bothers me. But this time it was very easy because in Vienna, they just changed it that all the PCR tests and antigen tests are free. So it's easier to travel when you know it's free. You still have to do a test when you land in Ben Gurion Airport. You need to do the PCR. This is why I'm still in quarantine. I'm waiting for my results. I just landed this morning. But this is again, it's a very easy. You just leave the airport and you can do it right away. But it's something that you need to pay for, and you need to consider this as part of your trip plans. But I know many countries in Europe specifically change it to be free, which make travel easy. And I have to say that, again, as you know, the rules changing all the time. Few days before we left, they just changed it that you don't have to stay in quarantine for 3 days. It's back to be 24 hours. Some countries that consider red countries like United States, that if you come back from United States, you need to stay in quarantine for 10 days. They now change it because of the Omicron situation we have right now in Israel. So we became a red country, so we can't decide it about other red countries. Complicated, as you know. But the main things that I need to say about people who travel, that you have to check the restrictions every time, even if your flight is on the morning after past midnight, new restrictions are on, and you have to know them, and you have to get ready for this. And a lot of people stuck in airports, and it's a big balagan, as Anna said. So that's my only takeaway.
Thanks for sharing that. So before I sign off and leave you with Anna and Rotem, I just want to just tell you who I am. My name is Bruce Rosen. I grew up in the United States. I grew up in Brooklyn, New York, lived in Boston for 10 years, and have been in Israel for the last 35 years or so. And the place I work at is called the Brookdale Institute. It's part of the Joint, the JDC, which is an American Jewish organization based in New York that helps Jews around the world, Jews in need around the world. So it's been great being with you, and I'm going to say goodbye and leave you to the rest of your meeting. Bye-bye.
Thank you so much, Bruce, for your time. Thank you so much. It was great. We loved it.
Thank you. Stay healthy.
And thank you very much for all of you for joining us. Before we all say goodbye, this is a great opportunity for us that we can see you. If you want to type in the chat, this is again our first program ever about Israel that we did, that we're doing with Columbia Jewish Federation. If you have any ideas, if you have any topics you want us to discuss, you want us to bring speakers, you want us to do programming on, so this is a great opportunity to type at the chat. Again, thank you very much for my dear friends from Jacksonville who showed up and stand next to me. I love you, I miss you. And Anna, you want to talk a little bit about our next programs?
Yes. again, thank you, Rotem, for being here, for making this happen. And just a small reminder for all the Colombians here on the chat, we have a great partnership with the Jewish Agency for Israel, and we also allocate every year money to the Jewish Agency for Israel to have those programs and to learn and engage people around Israel. And we're so lucky to have Rotem with us in our community. So please use him as a resource. You want to learn more about what happened in Israel at the moment, shoot him a text, shoot him an email, join all the programs that we have, because this is our opportunity to increase the knowledge that we have and to hear about Israel from Israelis, somebody that is there. As a former shlicha, as a former Israel fellow that worked with the Emory students in Atlanta, it's so powerful to have a shaliach. This is an amazing engagement tool. So please share with your community, share with your friends, bring more people to our next activity. And as Autumn said, this is the first session that we have. It's called Fed Ed, Learn More About Israel. That was the first one, and we have additional. The next one is going to be on February 13th at 2 p.m. We're going to send all the information via email, social media, follow us on social media. And if you have an idea for a topic, if you're interested in something specific, let us know and we'll make it happen. Ask Rotem to bring somebody specific and he will do his best to do that. So again, thank you so much. And I'm going to drop Rotem's email again in the chat. Thank you again for joining us this afternoon, and we hope to see you all in our next session of Fed Ed, Learn More About Israel. Have a great Sunday.
Guys, bye guys. Thank you so much.